Good afternoon, everyone.
Good afternoon.
Welcome to the Nash County Board of Commissioners meeting for the 19th of January at 1:30, and we're pleased to see each one of you here. It is customary for our board to begin each one of our meetings with a prayer by a sitting commissioner, and then to have a pledge of allegiance. At our meeting today, you're certainly welcome to stand and join us in this prayer. You can use this time to have your own prayer, or you can use this time to have a moment of silence. And at this time, I'd like to call on Commissioner Sue Leggett for the invocation, and then Commissioner Wayne Outlaw for the Pledge of Allegiance. Thank you. Sue?
Let us pray. Dear Lord, we ask for your oversight and blessings at this gathering here today as we conduct the business of Nash County. Please guide our actions, our thoughts, and our words so that they may be pleasing to you. We ask for your healing hand to all of those who are in need and for your guidance and grace during this time in our country. All of these things we ask in your precious and holy name. Amen.
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 Would you join us in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
As we do for our second meeting, when the months we have those for the Nash County Board of Commissioners, we generally will have an outside presenter come to us that the Board of Commissioners and the county is associated with in one way or another. And then we generally would have a department of one of our organizations inside the organization to do a update or presentation, whatever the department so chooses to do. And I will say, as we did at our last meeting, we do have a little bit different procedure now because of the COVID and trying to do everything like we're supposed to do it. We have our 6-foot rule, and you can see by the way we've got the chairs placed or the tags. And then the commissioners, of course, are spread out, and we've asked some of our staff to sit down front. Normally, they would be up here with us. We also, as we said last time, purchased a machine that we use to clean the podium between each speaker, and we have Megan with us today. Thank you, Megan. And if you would just give her a moment, which she has pre-cleaned it at this time, but each time we have a speaker, if you give her just a moment to do an additional cleaning on it, we would greatly appreciate that. And at this time, we are on item number 4 on the agenda, which is UNC Nash Healthcare System Update. And I'd call on our pleased to be here, Lee Isley, to make this presentation for us. And Lee, if you would, I'd just ask you to introduce the people that you have with you today.
Yes, sir. So,
Thank you for being here.
Yes, sir. Good to be with all of you today. I want to introduce, and I know that you guys are familiar, but Mr. John Barker, who is our chair for the Board of Commissioners for Nash UNC. He comes into his seat this January and has served two years as vice chair. Also very familiar to all of us is Dorsey Tobias. She's an executive director and on the executive team with Nash UNC, and so certainly glad to have her with us today as well. She is the de facto fact checker for me. So if
Understood. You have a good one.
Yeah, we do. So thank you for letting us be here. Want to review with you a little bit about our hospital. As we have shared in the past with you, we completed, the Board of Commissioners completed a strategic plan which looks out over the next 3 to 5 years for the health system and the items that we would like to achieve for our community and organization to ensure that you have a top-rated hospital. And those 4 areas you can see there under critical planning issues. It's a robust and engaged medical staff, a top-rated hospital by our public reporting systems like Leapfrog, CMS, making sure that we meet high-quality standards, a strong partner for our community in helping to improve our overall health, and the financially sustainable organization to be able to meet the needs of our communities. And so we'll go through just a little bit about each one of these and some of the major key accomplishments and the things that we're working on over the first year. We are in the second year of our strategic plan. And so the one area that I'm very proud of is that physician recruitment. So we have recruited 20 new providers in the last 18 months. I'll show a slide here following of some of those faces that I hope that you guys are beginning to see in the community. The vast majority of these, at the request of the Board of Commissioners, are living in Nash County with us, and so that has been one of the key elements. And so we are also addressing those items in year 2 of hospital-based specialty gaps. Those are areas that were identified by the medical staff and the community and the Board of Commissioners that we needed to work on. An example of those are tele-ICU, which has already been implemented. That gives us 24-hour, 7-day-a-week physician coverage of our ICUs. We have brought on infectious disease. Dr. Paula Delanchian joined us this summer and is on site with us doing an outpatient clinic and inpatient consult work for our patients. And so that was one of the most highly recognized needs by the medical staff. And then we are bringing on a partnership for teleneurology to ensure that we have 24-hour coverage in the hospital for those areas. So those are just some examples. As I promised, this is our some of the new medical staff members that have come on during fiscal year 21. As you know, our fiscal year and yours coincide with each other and are aligned. So this is from July 1st. We're very proud to have these individuals here with us in the community. Under quality and service, a couple of things that we want to highlight is that, and you may have seen in the paper and through other communications, Nash UNC was most recently recognized in the fall of 2020 as a Leapfrog A hospital and quality improvement. And so many of you were engaged in the conversation several years ago when we first started reporting to Leapfrog and are familiar with the improvements that we've made over the last several years. And so very proud of the staff and the medical staff for being focused on that. The other area that is a little harder for us to explain is that Medicare, CMS, evaluates us on our quality, and because of our improvements over the last several years, Nash was recognized by Medicare, and we have been able to improve our fiscal year 2021 reimbursements by $620,000 because of the improvements that we've made in quality. Under our partnerships, we continue to partner with community programs and organizations to address social determinants of health. We are working on a proposal to provide diet-specific meals at discharge for roughly 6% of our inpatients who identify as having food insecurity. That project, Dorsey and I met this morning with the individual who is leading that project for us. And then we continue to look at how the foundation supports our organization so that Nash is able to meet the needs of our community. And under financial sustainability, many of you have been with us over the last several years as we've continued. I will share some details about our financials as we continue to move forward. Most recently, and we continue to share, and we'll be back with you again on the master facility plan that to guide our facility on investments that we need to make both on the short term and long term to ensure that we have the physical capability and building structures to meet the needs of our community. So some recent accomplishments, I just mentioned our Leapfrog and Medicare. We continue to get recognized by the American Heart Association and the Cardiology Association on the work that our Heart Center does. Over the summer, with the height of COVID and preparation for the surge, we dedicated the Board of Commissioners, had us build out a special COVID unit to accommodate up to 36 patients in a specially prepared 2 wings of the hospital so that we could ensure that our staff and patients had the most safe environment in which to receive care. In addition, over the last year, we have expanded our partnership services and our role in standing up NASH surgery, working closer with a formal relationship between NASH UNC and Rocky Mount Urology, Eastern North Carolina Medical Group, UNC Cardiology at NASH, specifically standing up a heart failure clinic, our mentioned infectious disease, and then expanding our offerings and capabilities at UNC Orthopedics at NASH on our campus. So a little bit about our financials. You may have seen this we call it a waterfall slide, and you may have seen this 2 years ago. We came to you. We had, at the height, had lost $25 million from operations. The Board of Commissioners asked us to put a plan together over the next 5 years to turn that around. I'm happy to say that we are well ahead of schedule for that financial recovery. You can see under 18 where we had lost a little over $21 million in audited year 19. We had improved that to a loss of $1.9 million. In audited year 20, which was just our last fiscal year, we were well on our way. We had, through February, before COVID, we had realized a loss of about $600,000 from operations. And then the last 4 months of fiscal year 20 was when we had to shut down operations and prepare for COVID, stop surgery, and other things that hospitals did across the country. We were still able to realize our operating loss of $6.9 million. That does not recognize, as many of you know, that the federal government, through grants called CARES, issued dollars to municipalities and organizations to help offset those added expenses or lost revenues of the COVID pandemic. We actually recognized about $10.6 million in fiscal year 20, and that is not represented in that $6.9 million. And so from the accounting standpoint, the CARES dollars are considered to be non-operating, and so that's why you don't see that. In this fiscal year, through December, we were scheduled to be at $3.5 million. Through fiscal year 21, we were budgeted to end the fiscal year at 3.5. We currently are at a positive $1.17 million, $1.5 million through December. You'll see that in the details of the financials that I'll review with you in a minute. And so we continue to sustain our financials. That fiscal year 21 is without any CARES dollars recognized in that number. And so we have recognized about $4 million of CARE dollars in this fiscal year, but is not represented in the number there that I share with you. This is how, just so that you can see how we track our financial recovery with our Board of Commissioners. We review this every month with them. Just quite simply, the yellow bar is what we hope to improve over the budget, and the blue bar is our actual. So you can see that we continue to exceed our budget expectations and improve through each quarter. These are our volume indicators. I share this with you, be glad to answer any questions, but quite frankly, this is just to show you that COVID is impacting our volumes throughout the fiscal year. With the exception of cancer services, we continue to see growth and strong movement in cancer services. That's not overly surprising because of the timing and the nature of those treatments and services, but COVID is impacting us. Our financial recovery and improvement at this point is really built off of our managers and directors and their cost management and measures that the Board of Commissioners have asked us to put in place. So these are our financials through November. This just simply shares with you, looking at year to date, as I shared, our operating income through November was $1.17 million positive. Through December, as you saw on the waterfall graph, was 1.5. And then if you look down under investment income, you'll see where the CARES grants dollars are recognized. Through the CARE grants, Nash UNC was awarded $28 million. We used we have $15 million left remaining of those CARE dollars, and again, are very specific on how we can use those and are audited each year to ensure that we are using those dollars correctly for our response to COVID. Again, just another slide showing the key indicators that we share with the Board of Commissioners, which is our average daily census, ADC. And you can see that we're trending down slightly from prior year. Our ED visits, which we see as probably the indicator that will share last, as that volume comes back up, it will indicate to us that COVID is subsiding and individuals are feeling comfortable in seeking health care. And then our surgeries on an average daily basis. And so these are indicators that we share on an ongoing basis with our board. So a little bit about COVID. Certainly that has grabbed our attention over the last 10, 11 months. And so I want to share with you a little bit about how your hospital is responding. And so we receive every Tuesday an update through our partnership with UNC about what's going on across the state and what Nash can expect over the 4 to 5 weeks forecast. And so as you can see, the statewide COVID census, as you well know and hear from the media, has continued to go up. These are our projections tracking the COVID surge. And so we get these updates again every Tuesday. You can see this last update, which was last Tuesday, is suggesting that the COVID peak will occur sometime in early February to late January, and will continue to subside over and through the early summer. These are the projections for Nash. So you can see our projected volumes. We have, fortunately, been somewhat below what the projections have forecasted. We are currently today at 53 inpatient COVID positives. We have 5 of those individuals in our ICU. The remaining 48 are what we consider medically stable and are able to be treated on our COVID floor and other areas in which we have prepared for COVID patients. And so we review each month with our Board of Commissioners the detailed plans around our COVID response and how we are managing the COVID patients. As all hospitals across North Carolina and the country, the one deciding factor right now that has our attention is, of course, staffing. Our PPE levels are very sound. Our bed count and ability to house individuals is very sound. We continue to look at staff, and obviously the same staff have been with us, have been on the front lines for the last 10 months taking care of these patients. And so we continue to stay focused in that arena. This slide is already out of date. We just prepared it last week. And as you know, this is a rapidly evolving criteria for vaccination. Nash has vaccinated over 900 of its healthcare workers and physicians over the last 4 weeks. We had a meeting this morning with our community providers to include the health department and community practices on working to continue to increase the access of vaccines to our community and all aspects of the community. We had Boyce Willis, the health department, OIC, Harvest, all with us this morning as we prepare on how we're going to continue to extend the vaccine to our community. We trialed last week with Eastern North Carolina Medical Group through our partnership with UNCPN on getting the vaccine out. It was a good trial, and we continue to expand it this week as the state continues to expand its age group on individuals who are eligible for the vaccine. Be glad to answer any questions. That is our presentation on a short update on the work that we've been doing over the last year since I've had the pleasure of being with you and updating you and talking with you again about your hospital, our community's hospital, and the important work that is happening, the hard work that the staff and the medical staff are accomplishing for our communities.
Thank you, sir. Commissioners, questions, comments?
Yep.
Mr. Belfield, please go ahead, sir.
I have several. I want to start off, I noticed now that Rocky Mount Urologists is under UNC Health, you're partnering together.
Yes, sir.
And I've been told there's only 2 urologists in here in Nash County, in Edgecombe, and the city of Rocky Mount. Are you working on, since you're partnering, are you working on trying to get more?
Sir, yes, sir. So right now, we have 3, but one is trying to retire, and so.
Yeah, that's why, yeah, I know
Yes,
one
sir.
is.
And so, matter of fact, we had a candidate here with us on site Friday. We have offered a contract to that individual, and we continue to recruit. We believe that Rocky Mount Urology is at a minimum of 4-physician practice, and quite possibly could grow to a 5-physician. But we're working in partnership with the medical staff for that, and are committed to continuing to recruit for Rocky Mount Urology.
What percentage of people with no health insurance at all does UNC Healthcare treat?
So we look at it from self-pay. So our self-pay rate is around 6%. Of course, we do not turn away anyone that seeks care.
Well, those are the ones I was thinking about. What percentage of those that you don't turn away but can't pay?
Right, 6%.
6%. All right. Public relations as it relates to COVID-19. We have, and in my opinion, I think this is going to extend the viruses within the community, because some people just don't believe in wearing masks and don't even have washed their hands. And I've been thinking about how can we convince those people that even if you don't have any respect for yourself in catching this, you think about what you can do to your family and other members in the community. And I just think we need to start conveying that to people that just, at this point, just don't, I don't want nobody to tell me what I need to do or have to do. And some refuse to go in stores with the mask on, and they're being turned away and they're getting nasty about it.
Well, I couldn't agree with you.
But
I couldn't agree with you more.
We can't do nothing about that, but we can, I believe we can reach some of these people if we let them know you need to start thinking about your family and other members in the community and your friends when you're being around them, because you could be the one that transferred the virus.
It certainly could be a carrier with being asymptomatic. And so Dorsey has helped us, and there is not any communication in which we don't circulate or put out, or that we don't communicate, that always reminds people, wear your mask 6 feet apart, wash your hands, and be mindful of COVID. Certainly, I can tell you that my staff knows all too well the hazards of COVID. We treat and see those patients every single day. There are patients today that are in our ICU on ventilators, and they were relatively healthy before COVID, and probably didn't expect that COVID would have that kind of impact on them. So we certainly need to continue to get that out. I think that not only the social distance and mask and hand washing, we have to be mindful of. We have to continue to encourage vaccination and continuing the efforts of public health and the work that Mr. Hill and his staff are doing for us out in the community.
Well, I think you're doing a good job over there.
Well, thank you,
My
sir.
wife just recently, in November, had to pass through UNC Healthcare, and they diagnosed the situation and rushed her straight to Duke. And the helicopter medical staff, I asked them, I said, how long gonna take you to get there? They said 15 minutes. And
Wow.
when I got there, they had already done the procedure and was signing her to a room.
Well, I hope she's
That's
doing
how
well.
fast. And she's improving every day,
Well, good.
getting stronger and stronger.
Well, that's one of the areas that certainly you have asked and our Board of Commissioners have asked management to commit to is our emergency department. We have made huge strides in reducing the wait time. I will tell you, as I share with our Board of Commissioners at the hospital, this last 5 or 6 weeks have been very difficult for the emergency department with the rise in COVID patients and beds and capacity. And so, but we remain committed to improving the outcomes in our emergency department. So thank you very much, Ms. Belford.
That's all the questions I
Thank you,
have,
sir.
all comment.
Other comments, questions?
Well, actually,
Will?
when you appeared before us last time, I think I was an unhappy camper. But anyway, I want to tell you how much I am enjoying hearing the positive things about our hospital. Every day or sometime when I'm out about it, and I was in there twice in November and December, I never felt like that I was being pushed aside. I felt like I got complete attention. And it wasn't me because it was me, it was the whole staff. And I am very, very impressed with the young doctors y'all have.
Well, thank you, Ms.
They really, really,
I'm glad you had a
Step
good
in and take-
experience,
take care
and I
of it.
know that it wasn't because of you being you, because if it was, they would have called me and I'd have known to come see you. So they took good care of you because they need to take good care of everybody.
they do. Just want to commend you on that.
Thank you, ma'am.
Dr. Isley, I just want to say thank you and publicly commend you for your leadership at the hospital. As one of the board members, I get to see it firsthand, and we at the county really appreciate what you do there and what you do for our community.
Well, thank you. Certainly a privilege, and I'm humbled to be part of that organization. And thank you for your leadership as part of the county, part of the Board of Commissioners for the hospital.
Commissioner Aaron?
Yes, Dr. Alex, back to the COVID-19
Yes, sir.
rollout, for the public to know what's UNC's role as, I think I heard you said that y'all vaccinated the first responders, and if UNC will be a part of vaccinating the next group, and in correlation with our health department, what's the proper steps for people to take in order to get the vaccine? Should they call UNC? Should they call the health department? The public need to have a clear direction on how and when they can, the place they need to go. You mentioned Boris Willis, you mentioned Facebook. Would they be calling those health facilities? Just could you explain a little bit clearly for me and the public where
Yes,
the
sir.
rollout, the process?
Yeah. So we are working with Bill and his staff as we continue to roll out the vaccine. The health department and the hospital are the two entities right now that are receiving vaccines. Mr. Hill and I coordinate on a regular basis, and his team and my team are speaking on a weekly basis about our joint and combined efforts. So right now, what I would tell you is that if a community member would like to know where they can receive a vaccine, certainly the health department is a resource for that, and I encourage them to reach out to the health department. Also, they can go to Nash UNC's website and find yourshot.health, and or they could go to UNC's website and find yourshot.health. And from there, it will take them to the ability to see where those vaccines are available in the community and be able to schedule an appointment for the vaccine. We met today with several other physician practice groups. The county health department was certainly part of that group, where we are, by the end of this week, going to expand the availability of the vaccine to a wider group within the community. And Dorsey will be helping lead the communication on how an individual would be able to schedule an appointment.
Any special effort being made to make sure that the minority community is serviced equitably, I suppose?
Absolutely,
Any other
sir.
group?
So we have had discussions last week, and part of the group today was OIC. We're asking them to help us through that. Harvest was also there with us. I am working with UNC as we look at mobile vaccination clinics that will be rolling out. Nash County has been identified as one of those areas in which we will be bringing a mobile vaccination clinic to.
Thank you.
Other comments from Commissioners Dan or Wayne?
I'm good. Everything I hear about Nash UNC has been very positive for a while, and I appreciate y'all's efforts, and things are looking good down there.
Well, again, thank you, and if you see a staff member, please thank them. They're making the effort and working hard every day. And so, again, thank you for your continued support.
Thank you.
Thank you, sir.
One second, I do want to say a couple of things on behalf of the board. First of all, you heard Dr. Isley use the word Board of Commissioners numerous times. I hope you all do understand he was referring to his Board of Commissioners, and they're not some of us that's getting information that all of you is not getting. It's a little bit confusing the way it is between us, but it was Board of Commissioners, which you have your chairman here today that represents them. The second thing, and I'll just repeat what numerous of them have said, and which I'm glad they did speak up, because it has been a great difference in the last 2-3 years of what our Board of Commissioners deal with. It's to the point where we don't mind, because of the hospital itself, we have other issues going on all the time, but don't mind getting out in public, going back to church and going to the grocery store or whatever. It got to the point where we shied away from public meetings a little bit. But I tell you, it's been fascinating what has happened in the last 2 or 3 years. I'm not sure how long you've been here, Dr. Isley, but I know you had a great part of that, as well as your staff. But it's greatly appreciated by all the citizens of Nash County, the change that we've seen out there at the hospital in a very trying time.
Well, thank you very much
Thank y'all
again.
for being
Thank you
here.
for your support. Know that my board and the staff are committed to making sure that we're a good, strong economic partner for this area and region, and that we're providing care that you can be proud of and can recommend to your family and friends. And so thank you very much.
John and Dorsey, we greatly appreciate y'all being here this morning as well, or this afternoon. Maggie? The next item on our agenda is item number 5, and of course, it is an update on COVID-19 impacts on the emergency medical services of Nash County. And Mr. Brantley, if you will move towards the podium, I would also ask you to introduce the people you brought with you today, and we also look forward to y'all's report. Thank you for being here.
Good afternoon.
Good afternoon.
Well, we were going to bring Dale. He had worked on this report with Scott, and we had a situation come up this morning, and he is out actually deconning 3 trucks and 2 stations. So he was unable to attend, and it seems just part of the routine day that decons, showers. And I think you could see from Dr. Isley's report, it doesn't seem to be getting better. And you'll see Scott had worked on this with Dale, and it is still very concerning of what our staff is having to go through. And they are certainly stressed, but they continue, just like the hospital staff continues to serve the citizens. We've also, unfortunately, had a positive or 2 in 911, and I do think that the procedures that we have in place, the protective shields that we put in place, the decon and taking temperatures before they come into the center has really made a huge difference that it didn't spread throughout the center. And that has happened numerous places in the United States. And without 911 workers, we can't dispatch the first responders. So we're very careful about how we're protecting our employees and want to thank them for the hard work they've done to stay safe for that. But I'll ask Scott if he would to come up. And this data is through January the 13th. Dale and Scott worked up that data, and you'll see how that has compared to what we told y'all in December. And thank you for the opportunity to let us update you on that, too.
Good afternoon.
Afternoon.
So look forward to the opportunity and appreciate the opportunity to come back and update the board on where we're at. We've been continuing the efforts that we talked about last month, pretty much nonstop, 24/7 since our last meeting. A lot of the things we showed you in the last presentation are still ongoing every day. In fact, on the 11th of January, I think we set a record on the number of times decontamination processes were required in a given shift with 17. So we basically had a 24-hour decon operation going on that given day. And on the heels of that, I still compliment our staff on their attitudes and the, I would say heaviness, but the morale in general is still above and beyond, I think, what could reasonably be expected, all things considered. Some of the updates on the numbers that we showed you last time, I went back in and added it through the end of the year. So from the beginning of COVID for us, which was March 15th through the end of December 31st, with 759 either confirmed or potential high-risk exposures, resulting in almost 1,100 staff decontaminations. We'd had 96 tests done amongst our staff in that time, and 17 employees test positive during that. The 108 staff quarantines, that number represents not only those who were positive and had to be out of work, but with our kinds of shifts, they get tested today. They may have 2 or 3 days out before we get results. And then they are technically quarantined during that period until we can hopefully get that negative result and go through the steps to get them back to work again. So there's a significant amount of time, one way or the other, involved in that. As far as vehicle and facility impacts, and the graph on here is updated through January 13th. So 759 total exposures, as in vehicles that had to be decontaminated. And then, of course, the almost 1,100 staff decontaminations as well. I actually looked 1 o'clock today, and for the month of January, our ambulance decons are at 117 for the month as far as the number of times we've had to decontaminate units. And as of today, with the good work that Dale Griffin is doing as we speak, there will be 12 station decontaminations being done. Dale is having to, after quickly tracing through the potential exposure, he is decontaminating 2 stations and 3 units. There's been no direct correlation to any problem with that, but we want to make sure we eliminate any potential to keep the staff safe. So that's where Mr. Griffin is at right now. And he is utilizing the equipment that through the grants and processes and allocations of the board that to make sure we keep the staff safe. So the AmbuStat machines and some of the other equipment we showed you in our previous presentation are being employed as we speak. Additionally, since we last spoke, we continue corrosion repairs on our equipment. After 8 or 9 months of decontaminations and chemicals and cleaning, we were starting to see corrosion and wear and tear on some of the equipment. That process is ongoing. In fact, 6 of the ambulances had to be gone through and parts replaced, and that work has all been completed now. Most of the equipment that was replaced, as far as nuts and bolts and some of the minor things, were all done with stainless steel to try to prevent future corrosion problems. We had ambulance stretchers that are showing signs. That work is ongoing. And then some of the bathrooms, because once somebody finishes actually taking a shower, then we have to sanitize the shower as well. So fixtures and stuff and that was showing signs. So that work is ongoing as well right now. Went back and checked, and this slide actually was able to go unchanged. The amount of PPE actually has not dramatically increased as far as the overall month-to-month average. There has been some increase in the month of January, but not to the point yet that it affected the average overall. But it's still an incredible amount of PPE that we're using. And but give credit to Dale Griffin and Jeremy Bunn, who are minding that side of the shop. They're doing a fantastic job keeping supplies in orders and keeping a sound stock on that. The challenges remain the same. You know, we're preaching keeping distance and wearing masks and all that, but when you're basically trapped in another vehicle with somebody else for an entire shift, between the two of you, it is obviously very difficult. There's no way to maintain social distance in that. And then when you're inviting, you know, the other participants of calls, be it patients or families or whatever else is required, and that is also very difficult at that point. But overall, I think they're doing a great job as best that can be done. As far as call volume goes, we finished off the data for the year 2020, and you can see on this that we, towards the end of the year, we more than recovered our volume from COVID and even added some. So, to give you an example, January 2020, we run 1,954 calls, and then in December, I apologize, my number got cut off there on this printout. But we were above that, I believe it was just shy of 2,100 calls total, so we more than recovered our volume and have added some to that. Staffing, which has certainly been a concern over time, is at this point, we've got 4 positions that we are currently hiring for. We have a process in place already ongoing right now for those positions. One of those positions is due to Cleveland Hunt's retirement after 51 years of service. So if anybody's earned it, he has. And then we have 2 other positions that the board granted us in the last meeting that we are hiring for currently, which will be 24-hour positions. And then we have a 3rd position, which we got authorization to move from a 40-hour-a-week position to a 24-hour-a-week position. So it took a little bit of reallocation of funding for that, because the 24-hour person works almost 900 hours more a year, so we had to shore up the budget behind that spot. So we certainly appreciate that, and I hope by the end of next week, we have people hired, and we're starting that process of getting them in place. So certainly appreciate all of you for that support with that. And we get that done, we will be fully staffed, at least for a few weeks. We do have another pending resignation that is coming in February. So we actually have that on the radar, and we'll be making sure we take steps needed to get that filled as quickly as possible as well. Vaccinations, we've had 37 EMS staff members have received their first shot, and we certainly appreciate all the great work the health department has done in supporting our staff with that. In fact, I think next week, some of our staff starts their second shot. So excited about that. And then EMS did play a role in helping support the health department's drive-through vaccination clinic to include monitoring those who were vaccinated for their either 15 or 30-minute wait period, and also assisting in giving vaccinations. We did designate one of our paramedics to help the nurses in actually giving the shots. So those, obviously, we learned a lot in that whole process, but overall, getting over 900 of our citizens, most at-risk citizens, vaccinated in a day's period was, I call that a success, despite all the interestingness to it. So we certainly appreciate what the health department did to do that as well. So I'll be happy to entertain any questions that you may have based on that report.
Or comments?
It's got a couple of questions, Scott.
Outlaw?
When you're talking about deconning the trucks and the corrosion issues that you're having, and I see this young lady kind of deconning that station that you're standing at, is there any application, and would it be cost feasible to do something with the trucks like she's doing here? Because I would assume that even post-COVID, you have to clean the trucks up.
Yes, sir.
So you probably have got a corrosion issue that's probably greater now than it normally is, but it's still an issue.
Yes, sir. We have actually already worked towards mitigating that by changing the type of solution that we're using. Most of that corrosion, we believe, was caused because early on, initial part of our process was to spray everything down with a 1 to 10 bleach mix, which obviously is very corrosive, especially over time.
Yeah.
We have since changed to and found other solutions that are not as intense, but still meet all the guidelines that the CDC requires for sanitation. So
What is the cleaning frequency of a truck after COVID? Is it daily when they bring it in, or what's the frequency?
it would be a minimum of, post-COVID, it would be a minimum of once per shift.
Right.
As far as any kind of deep cleaning would be required.
Okay.
Depending on the call type and
Then
the
the type
patient
of
type, it
call
could be
might
more than that.
necessitate that it be more than that.
Yes, sir.
One thing we used to hear a lot about, and I'm sure it's still an issue, but I don't hear anything about it, is opioid activity. What's the status of that?
Yes, sir. It's certainly,
Are you getting about the same number of calls, more calls, less calls, or? I don't hear much about it anymore.
yeah, it is certainly still ongoing. We are certainly not in the storm as we were before initially, where I know locally we reached a point where we were given 3 to 4, we're seeing 3 to 4 of these patients every day. We're down to about a patient and a half every day, which is actually closer to, I hate to say it this way, but what has been typical over the years.
Do you know what happened to just all of a sudden when COVID came? It seemed like it just kind of went off the scene.
I think the trending, I'd have to go back and look to be sure, but my memory serves it such that the trending had already started going down, and I think it has more to do with the availability of Narcan and I'll give the Sheriff's Department credit. We could see impact in our numbers based on their activity.
So you're still using the Narcan?
Yes, sir. Yes, sir.
Can you just look at that and provide us with that information to show that where that was and where it is now, and any trends and, you know?
Absolutely,
Yeah.
yes, sir.
Staffing, shifting. I hear from time to time, and I don't know much about how you're staffed and you handle your shifts, but I hear 12 hours, I hear 24 hours. Is there anything that we need to hear about that today?
Well, I would say, we've used the same 24-hour shift schedule since the inception of our organization. So since 1986, our staff has worked, a 3-shift schedule and to provide 24/7 coverage. To do that, a normal average work year, number of hours worked per year, is 2,912 hours. 40-hour-a-week employees, typical employees work 2,080. So, and when you add training requirements and meetings and stuff, it's not unusual for our staff, if they just work what is required of them, that they work 3,000 hours in a year. So one of the primary concerns that comes out of that is fatigue. And, even when I first started, call volume was much lower. Well, call volume has done nothing but increase. So there is even less downtime now within that 24-hour span. So increasing the degree of concern about fatigue.
So going forward, is that something that needs to be addressed, should be addressed, or? I was expecting to hear a little bit more about that today.
Yes, sir. I think it's something that certainly needs to be reviewed closely. There's certainly significant financial implications that I think need to be looked at closely along with that. I guess the simplest way to put it is everybody else, every other county around us has already addressed it by changing the shift and schedule that they work.
So is every other county around us different than us in that regard?
Yes, sir. Everybody else is doing it on a 4-shift cycle instead of a 3. So they're getting 24-hour coverage, and any individual employee is working or require 2,184 hours instead of 2,912.
Okay.
So, yes, sir, but that's a very sensitive subject because it does become very costly very quickly, and I want to make sure that I don't want to come up and just throw anything at you that hasn't been thought through very well.
Okay.
Because I want to be a good steward of the money for the county. So.
All right, last thing I want to ask you, in your staffing model that you showed, 75-25 across 3 shifts, where do the community paramedics fit in that staffing model?
The community paramedics on this list that you saw are 1 or 3 of those 75.
Okay.
There's 1 of them on each of the 3 shifts.
Are they still being utilized, I would assume, with the COVID situation?
Yes, sir.
So they're not really into the community paramedic thing as much as they have been in the past because of that?
Yeah, one thing that COVID has certainly impacted is the community paramedic program as far as the total number of patients they're able to see. A lot of patients are just not inviting people to be coming in their house very much right now. Rightly so. They are still seeing patients, certainly, but that number has decreased some. And they're doing as much as they can. Even the ones that don't want visitors, they're supporting them over the phone as much as they can as well, and still setting up resources and doing things they can to support the patient family.
I just hope everybody has a pretty good understanding of that program and the benefit of that program. And so with that said, can you guys just provide something going forward that would show us the benefit of that program and even how that program benefits the hospital? Because I think it does.
Yes, sir.
Okay.
Yes, sir.
Thank you. Thank you,
Absolutely.
Scott.
Thank you.
Other comments, questions from commissioners? Ms. Belfield?
You mentioned the 24-hour shift. Does each individual on duty 24 hours or that's 24-hour call for that particular shift?
They come
Which
into
is
work. They come into work at 7 a.m. and they go home at 7 a.m. the following day.
Other questions? I have just 2 quick things. I was a little bit surprised at your 37 number that had already taken the shot out of your 88 employees, 75, 24 shift employees. to be blunt, why is that number not a little higher?
I think there's just general concern at the speed of the development of the vaccine, I think is what created most of the trust issue that I hear about it. Certainly, the number climbed. The first group that got it was much smaller, and once they realized people were getting it, then more started signing up, and it's still occurring. I think our staff is like a lot of the population, where it's going to be the more people that get it, the more people that get it. So, because there's just this, I don't know, trust is the best word. There's just that.
So it's not a matter of us, because I know y'all were first. So it's not a matter of us not being able to do it. It's a matter of your people got to agree to have it done.
Correct, yes, sir.
Okay. Well, I'm still a little surprised at the 37 number.
Yes, sir, I would certainly, personally, I would certainly like to see it at 100%, but,
Well, I would expect it not to be 100%, but 37, I guess, concerns me a little bit. Commissioner Outlaw brought up the question about the way we decontaminate the trucks, and he mentioned the machine that we're using in here, which I know are used quite a bit in the airport industry, in the airplane industry itself. Is that something that y'all are going to look into to see if the county needs to invest long-term in another product of that nature to do it that way, or is it an acceptable method? And you don't need to answer me today. I'm just trying to get you to think through that process
yes,
long-term.
yes, honestly, I don't know much about it.
Right.
So, but I am certainly willing to look into anything that would appear to be of benefit to our staff. So,
And I just know this is a period of time that the county's in that we have access to a lot of funding at this point in time that something like that would qualify for. So
yes, sir.
that's y'all's, y'all need to study that. I certainly not educated enough to tell you what to do by any means, but I would think it would be something we'd want to study, particularly while funding is available.
Yes, sir.
Whether it be speech machine we have, some other machine, or some other process, because we spend too much money on these ambulances, as we all know, to do anything that would increase the corrosion or deterioration of these very expensive vehicles.
Yes, sir.
All right, there's no other comments. We greatly appreciate you being here today, and if y'all, Mr. Brantley, would just please let the staff know that the commissioners greatly appreciate and certainly understand the stress that they're under, but we sure thank them for all that they're doing.
Yes, sir. Thank you very much. We certainly will.
Appreciate it. Maggie? The next item on the agenda, actually, Brian, it is one for yourself also about a tax-exempt loan. You'll give Megan just a moment. I might have missed getting done between the last two speakers. I'm not sure. If I did, I certainly apologize. Thank you, ma'am. On item number 6.
I would just like to add on the question Mr. Outlaw had about the schedule. We feel like that schedule change is definitely got to come sometime. And that we have looked at numerous options. We've talked to county after county about how things are working. And when this board, we feel like that it's time to make that change, we certainly want to provide you and the county manager with a plan that we feel like is a plan that we can adopt to the transition that it's going to take, because you've got to take in so many new employees, get them trained, and then get them on the fourth shift. And whether that's a 12-hour or a 24-hour shift. As Scott said, ours is 48-hour weeks and 72-hour weeks, and the other schedules are less hours, 2184, I believe, versus 2912. And so we certainly would love to see that for our employees. But right now, with the limited number of applicants that we're actually getting, it's going to be quite a transition to try to get 25 new employees. But I certainly appreciate the thought of welcoming that for the employees.
Can I just make a comment on that, Mr. Chairman? Sure. I don't, I agree with you, the timing is bad to actually make a move like that, but I think the timing is perfect if that's something that you feel strongly as head of that department that needs to be looked at, that you go ahead and put those models together. So at least, first thing you got to do is you got to get this board to agree to any change in the model. So I think, so I would be putting those models together and be reviewing them with the county manager and trying to come forward with what you see as the longer-term vision for the staffing in the EMS department, because I hear a lot about it, but I hear it and then it goes away, and then I hear it and it goes away. So, if it's something we need to do, then convince us and give us the logic, the advantages or disadvantages of doing something like that. And I'm sure the manager will listen to it, and then we'd certainly hear it.
Okay,
Thank
we
you, sir.
certainly can, I would say, fine tune what we have already researched
Thank you, sir.
and get some information to you.
I just add, Brian, to that, because I keep this on my mind quite a bit, and I talk to our employees, and you're gonna need to keep them involved, because you got many of them that much prefer the 24-hour shift.
Yes, sir.
So I don't know how you get through that, but I just know our last 10 and 5 or 6 of them won't stay 24 hours, so. you have
Yes,
to
sir,
work that
and
out
that's,
before you get everybody happy.
That's the good thing, is that there are 24-hour shifts that reduce that 2,912 hours down to 2,184, where with the 12-hour shifts, you're still around 2,100 hours. So you look at it, we still can possibly keep the 24-hour shift, but that employee doesn't have to work, off, and then come back 4 days later. He actually gets a break. He works 24, he's off 72, or she. And that gives them a break between shifts every day. Every 3 days they come back. So there are some real possibilities, and I certainly will work on that, and thank you.
Item 6.
Item C, excuse me from getting off there, Mr. Chairman. The Coopers Fire Department is seeking a tax-exempt loan from Southern Bank and Trust for the purpose of purchasing a new apparatus. A tax-exempt loan requires a resolution approved by the county commissioners. Approval of this resolution does not commit the county to any part of that debt, and this is, of course, for Coopers purchasing an apparatus with them, and the principal amount, as you should see in the resolution, is $150,000 for Coopers, and just need a adoption of this resolution.
Any questions? Entertain a motion for approval of the request.
Move approval.
Got a motion by Commissioner Bellfield, is there a second? Second by Commissioner Leggett. Any questions on the motion? All in favor of that motion, let it be known by saying aye.
Aye.
Any opposed by a like sign? Motion carries. Thank you, sir.
Thank you all. Thank you for your support.
Item number 7, Megan. Ask if you will be coming forward. We'll have a presentation on the emergency paid sick leave policy, which is probably evolving as we go also, I guess.
Good afternoon.
Good afternoon.
I believe the comments and information you heard from Mr. Isley, as well as our own EMS department, kind of are a good introduction to why I'm standing before you today, which is to request the approval of a Nash County emergency paid sick leave policy. As you are aware, the Families First Coronavirus Response Act, or FFCRA, required employers to provide employee emergency paid sick leave to employees who were out of work due to COVID-19 related reasons, and that expired on December 31st of 2020. During the year 2020, approximately 220 Nash County employees, which is basically a third of our full-time employees used all or some portion of that emergency paid sick leave. As COVID continues to be prevalent across the country and within our own community, a substantial number of our own employees continue to be affected by the virus and they're unable to work. I'm aware of at least 36 who are off payroll at least one day for this month of January due to COVID-related issues. So as you can see, it's an ongoing issue. It didn't end December 31st. With the reports and statistics that we've heard earlier and that we're hearing reported in the news, they do suggest that this trend may continue well into the 2021 calendar year. As a result of this, I'm requesting approval of the Nash County policy that will extend certain aspects of the FFCRA as follows. An extension of the deadline of the emergency paid sick leave through March 31st, 2021. Employees will be eligible to use any emergency paid sick leave balance that they have not already used up to the 80 hours that was provided by the FFCRA. And the emergency paid sick leave will only be granted for items 1 through 3 of the FFCRA. And items 1 through 3, just to refresh your memory, is the employee is subject to a federal, state, or local quarantine or isolation order that's related to COVID-19, or the employee has been advised by their health care provider to self-quarantine because they're infected with or they've been exposed to COVID-19, or because they are at high risk of complications from COVID-19. And lastly, the employee is showing symptoms of COVID-19 and they're actively seeking a diagnosis but haven't received it yet. Are there any questions?
I'd like to, if I could, get Mr. Lamb's comments on this, if you have any, sir, prepared, or any thoughts on it.
Yes, we've kicked this around for several weeks, if not a month. The situation is you have 200 and some employees who took advantage, well, didn't take advantage, but
Utilized.
They utilized the sick leave, and we continue to get employees that, other than daycare, pretty much, are having symptoms and are being told to stay home. And so we want to give those employees the same benefit that the earlier employees have received for the same illnesses and situations. So that's why we're asking just for a 3-month extension and then see how that goes.
Do we have any concern that there was any abuse of the policy? Abuse of the policy, you're going to always have some.
Yeah.
So,
Well, the one thing that we're not including is the daycare. That was an allowable 80 hours if you couldn't. And so that's the one area that we had concerns about. So we're not including that as a reason. It has to be one of those other factors. So to answer your question indirectly, if there was any abuse, that might be where we had a little. Yes, sir.
Okay. Any other questions, Mr. Outlaw?
So I thought you just answered my question, but I don't know if you did or not. If we have an employee that has a COVID situation that requires quarantine, then it's going to certainly be more than a day. 10 to 14 days, maybe.
Correct.
So when I heard you talk about daycare, that kind of helped me understand when you said a day, why you might have an employee out for a day. Because there may be a situation in a daycare where their child does not have the care that they would otherwise have, so they would have to stay home and take care of that child. And then I thought I heard you just say that daycare was no longer a part of this going forward.
Right. We're not asking that we continue that allowance of people taking, what was the term? Utilizing this leave policy because of daycare.
So if a person has to go out and utilize this program, then they pretty much will wipe out the 80 hours with one event.
About 2 weeks, yeah.
Yeah, so you'd wipe it out.
They could.
So why would daycare not continue? Because to me, that seems, that would be something that would be easily verified. If I had my child in a daycare center and I said, they've got problems, they cannot manage my child today, they've got people out with COVID and so forth, so it seemed to me that could be easily verified. Well, what was the logic for taking that out?
May I just add, I think initially, the people who used it for daycare did use like the full 2 weeks, because initially, daycare's closed completely. So people that are taking 1 or 2 days, generally, they're just waiting for test results to come back. That's why we're having the 1-2 day waits generally from employees. But initially, daycares were closed completely. So we had employees that were, taking a full 2 weeks
Yeah.
to take care of their children.
Okay, well, it took me 3 days to get my results.
Right.
So, I don't know, you mentioned daycare, it seems to me that would be a reasonable reason to utilize that.
Well, you still have your normal days in addition to these days anyway, I would think.
Yes.
Yeah, you can still use sick leave or vacation day for,
Okay.
All right, it does require a motion for approval. I'd entertain a motion this time for approval as the Nash County Emergency Sick Leave Policy as presented.
Motion for approval.
Moved by Commissioner Combs, is there a second?
Second.
Second by Commissioner Wells. Any questions on the motion? All in favor of that motion, let it be known by saying aye. Aye. Any opposed by a like sign. Motion carried as well. Thank you.
All right, thank you very much.
Megan. Mr. Boone, you're next on item number 8, which is Nash County Detention Facility Contract Amendment with the Mosley Architects. Good afternoon, sir.
Thank you, Mr. Chairman, fellow commissioners. Item 8 is a contract amendment, as you indicated, with Mosley Architects. This is work related to the renovation and expansion project for the Nash County Detention Facility. As you are likely aware, the county is working with the town of Nashville in reference to a requested closure of 2 blocks of Elm Street between Drake Street and Body Street. And in order to prepare the material required to submit that application, which actually we submitted an initial application and a revised application, Mosley Architects incurred some labor to provide schematics and cost estimates that were needed to support that request. So this contract amendment is the amount of $2,423 and is related to services associated with that street closure request. Any questions, I'll be glad to answer those.
Any questions on this item? I just have one. Mr. Lamb, do you not have the authority to approve something like this up to a given amount, or not in a contract like this?
I do. According to the finance officer, I do.
Okay.
Okay.
I don't know what that limit is, but might want to take that into consideration. Where where you could do it, I think it would be fine to do it. And I think you would report it at the next board meeting.
Okay.
Okay. All right, no questions on it. I'd entertain a motion for approval.
Move for approval.
Moved by Commissioner Outlaw. Is there a second to that
Second.
motion? Second by Commissioner Belfield. Any questions on the motion? All in favor, let it be known by saying aye.
Aye.
Any opposed by a like sign. Motion carries. I asked that question because I got asked by a commissioner, didn't I think these agendas for the second meeting were getting longer? Quote, unquote. Next item is also you, Mr. Boone, which is item number 9. It is a contract amendment for the Wooten Company for the land at Cooper's Field And when we finished that one up, if you recall, we had a item at our first of the month meeting concerning the well and some additional costs for the Wooten Company as well that we postponed to a time Pacific. That time Pacific was today, and therefore it wasn't put on there as an agenda item because it was already scheduled at our last meeting. And if you would take this one, it'd go into the next one at the same time, as soon as you finish that one. And I will say both of these items were provided at your desk when you got here today, and we would be doing the one first about the landing at Cooper's Field.
All right, thank you again, Mr. Chairman. As you indicated, this is a contract amendment with the Wooten Company. This particular amendment is related to additional services required to prepare an easement plat in order to connect the water main installed on Blue Heron Drive to the water main constructed as part of the Northern Ash Water System project. We had to acquire an easement across a lot owned by the Homeowners Association, so this is services related to preparing that easement plat.
Any questions on this one?
And I didn't mention that is in the amount of $1,700.
And will probably fall under the same category that we just talked about possibly. Mr. Lamb, do you want to talk to the finance director about that?
Could I have done this? Okay.
Okay.
Yeah, we'll try to,
I'm not criticizing.
Screen those.
I know
Yeah.
you got a limit that you could do, and it would move us along a little quicker. Entertain a motion for approval on this one about landing at Cooper's Field. Moved by Commissioner Leggett. Is there a second?
Second.
Second by Commissioner Combs. Any questions? All in favor of that question, let it be known by saying aye.
Aye.
Any opposed by a like sign? Motion carries. Mr. Boone, if you'll move into the other items and explain what you've done with this one.
All right, again, the third item I have for you is, again, another amendment with the Wooten Company. This is for work related to the Northern Ash Water System project. You may recall our meeting earlier this month had submitted a amendment that addressed a broader range of services associated with that project. Based on additional conversations with the Wooten Company, we have, for the time being, reduced the amendment to only address the additional services required to extend the water main along Rose Boulevard and James Bunn Road to the proposed well site, and the construction, observation, and contract administration services associated with construction of the community well on James Bunn Road. And then because of the changes to the project and the documentation required by the North Carolina Department of Environmental Quality, we had to update our preliminary engineering report to address the current scope of work. So all those services together come to $69,800, and that is the scope of this particular amendment. We will revisit those other services at a later date.
Any questions here in layman's term? The large change order request we had last time has been broken down to cover what there's no question about whether the board needs to approve or not, because it's new work that wasn't in the original contract. And I think the staff is going to continue to work on the other items and work through those with the Wooten Company as well as the contractor to see what we can do to contain part of those costs moving forward. So I will say that, in my opinion, we really need to approve this one because it is all new work. Any questions? None, I'd entertain a motion for approval.
Move for approval.
Moved by Commissioner Outlaw, is there a second? Second by Commissioner Wells. Is there any questions on this one? All in favor of the motion, let it be known by saying aye. Aye. Any opposed by a like sign? Thank you, Mr. Boone, I appreciate your work on this. Donnie, you're up next. Thank you, Meg. Good afternoon, ma'am.
Good afternoon. This is for the Northern Ash Water System Capital Project Ordinance Amendment. The attached amendment realigns the Northern Ash Water System budget line items based on the most recent project estimates, including funds received for the purchase of water meters. And it's just increasing, it's realigning the expenditure line items and also increasing the revenue available by by the income that we've received from water meters, which is $52,045.
I wasn't keeping up. Do you mind saying that again? I'm sorry.
So we have water meters as part of the project,
Right.
And so the income that's coming for that, we're adding to this project so we can purchase more water meters. So we've added that in, it's $52,045. And in addition to that, we've realigned some of the expenditure line items in the project to account for some of the contract amendment that we just did, moving some money out of contingency and some other line items, construction observation and things like that.
The majority of this money is a good thing because we're picking up more customers.
Yes,
So, am I correct, Mr.
that
Boone?
is, that is my understanding.
Right, okay. Any questions? Entertain a motion for approval of the budget amendment.
Move for approval.
Moved by Commissioner Outlaw, is there a second?
Second.
Second by Commissioner Bellfield. Questions on that motion? All in favor, let it be known by saying aye.
Aye.
Any opposed by a like sign? Motion carries as well. Busy man you have there, Ms. Wells. We're now on item number 11. We okay to keep moving? Anybody need a pause? Okay, we'll keep moving. In item number 11, which is Commissioner Committee and Special Reports, and Mr. Outlaw, I'll turn that over to you this time, sir. Thank you.
Thank you, Mr. Chairman. We'll do the 7 districts today, starting with Commissioner Arrington in District 1. If you have anything to report, sir. Nothing? Thank you, sir. District 2, Commissioner Bellfield.
I have 2 of these committees going to meet this week. One this afternoon at 5:30, Upper Coastal Plain Council of Government. Thursday, Juvenile Crime Prevention will meet. Todd River Transit has met, and you're in our first monthly meeting. We approved the grants. We had already approved them as a board, and then we had to take them to the commissioners plus the city of Rocky Mountain, and that has been done. So we're moving forward with that. It met last week, and I had to miss it because of a conflict and having another meeting. So I don't have a report for need. Stacy, did you do anything that's important that the commissioners need to know about?
No, sir. We were just taking care of regular business so that the regular meeting this month, we can do board training. So we're good.
Okay. All right. That's my report.
Any questions for Commissioner Bellfield? Hearing none, District 3, Commissioner Cone.
I don't have any report. None of the other committees is meeting. Trillium meets January 26th virtually. So that's all I got.
Thank you, sir. Commissioner Leggett, District 4.
From the hospital board, as you heard from our CEO, Dr. Isley, we've got a new chairman of the Board of Commissioners, Mr. John Barker, who is present today. He's our incoming chairman. The hospital board continues to meet monthly, and despite what's going on with the pandemic, the hospital continues to work hard and to having good patient outcomes and experiences, and is continuing to look both short-term and long-term at different things they can do there. The STEP board, their next meeting is March 16th. We did have a work session scheduled for this Friday, but it was canceled. Their new board president is Mr. Reginald Silver, and they're continuing to carry out the mission of the organization through online programs and grant opportunities with local schools. The Natural Resource Resilience Committee met on January 12th with 8 members present. I was unable to attend due to a conflict, but did get an update. They had some broad discussions of what has previously been done in the county and what they would like to see done, including some more additional stream cleanup, and flood prevention was one big topic of discussion. And I look forward to pursuing that. Thank you.
Thank you. Any questions for Commissioner Leggett? Hearing none, I recognize myself. Nash Community College, we met virtually on, actually, on January excuse me just a minute, let me get in the right area. Last meeting was in November. It was a Zoom meeting. There are no significant items to report from this meeting. Would indicate that Sonny Foster serves as chair of this board and Catherine Fisher serves as vice chair. Upper Coastal Plain RPO TAC met virtually on January the 14th. In addition to myself, other Nash County representatives on this committee are Brenda Lucas from Spring Hope, Craig New from Red Oak, Lou Harvey Lewis from Middlesex. Mr. Lewis serves as the committee chair. Also, Melvin Mitchell, who replaced Gus Tullis as the NCDOT Board Representative for Division 4, participated in the meeting. There were no action items for the committee from the meeting. Last item is Broadband Committee. Our last committee meeting with Cloudwise was on January the 7th. In this meeting, we received a Phase 2 and Phase 3 update, including expectations and timings for the move from Phase 2 to Phase 3. We discussed funding, including grants, as well as other matters related to the expansion of broadband in the county. And I've asked Ms. McGee to prepare a summary, and that will be made available to you via email, and I'll get that to you later this week. I want to thank Ms. McGee for her continued efforts with this particular committee. She's really quite busy, and she just didn't have time to get that together today, but we have talked about it, and she sent me something, and I asked her to make some minor changes to it, and once I get that, then we'll get it out to you. Our next meeting with Cloudwise is on February the 4th. Any questions?
Yes. In the legislative meeting this past Thursday and Friday, they talked about other methods that rural areas might be able to use that don't have broadband, and they'll be discussing this with the legislators when they present the goals and objectives. Have you heard anything about that?
Not personally, I have not, no, sir.
Okay. Well, I don't have all the details. One mistake I made, we had the instructions to unmute yourself while they're talking, you're muted. And then when you want to say something, you unmute yourself, but you had to raise your hand. I forgot to hit the video. And I kept raising my hand. I said, I don't understand why they don't recognize me. And so, and I ran it through my mind after everything was over. Did you realize that it's also said down there, the video? So that's why they didn't see me, and then the president didn't see my hand, even though I had it, I could see it on the monitor.
Yeah, you could see it, I understand.
But I had not turned on the video, so they could see it. But anyway, that was a discussion. That was one of the things that I wanted to ask to try to get more information on, and was never recognized. And I realized, and I didn't nobody had to figure it out for me. I figured it out for myself, that you didn't turn your video on, so that he didn't see it. But it's something that they're looking at, and there's some kind of technology that is coming in place where rural areas that don't have broadband, or they're so slow getting it, can use this method.
I believe that was on our legislative goals agenda, so.
It was.
Well, anyway, it's in there
Yeah.
to be presented to the legislators.
I had that on majority of the days, both days, and was monitoring it from my office as I was working. And I heard that conversation, and of course, there are probably 20 other ways you can provide rural internet, but we have kind of, at this point, picked our way. We're gonna go towards it. Of course, the technology and what we're doing is ever changing in the cloud base also, so. You know.
And they mentioned about these towers, that
Right.
this can replace having to construct those towers.
Right, yep.
And I thought it
Definitely
was really
evolving.
interesting, and I wanted more detail, but never got recognized because I didn't have my video on.
Thank you, Mr. Belfield, for that question. Any other questions? District 6, Commissioner Wells.
No report.
Thank you, Ms. Wells. District 7, Commissioner Davis. Once Commissioner Davis finishes his report, then I'd turn the meeting back over to him. Thank you, sir.
Okay. The TDA had a meeting scheduled for the 12th. I, as chairman, had to cancel that meeting because I was quarantined at the time. We haven't rescheduled it yet, but we will be rescheduled in the next 2 weeks. MPO, we have not had a meeting, and we will be having our next meeting on February the 15th virtually. So I have no report other than that. Moving on, Mr. Lamb, did you have anything you want to bring before the board at this time?
No.
Okay, is there any commissioner, it's not on the agenda, but any commissioner got anything else they want to add? Commissioner Leggett?
What is that, for the closed session?
No, I'm gonna go, I hadn't got to closed session yet. I'm really just giving the commissioner opportunity to bring up something if they want to before I go to closed session. And Ms. Leggett's been recognized.
Thank you. I wanted to bring up a concern to our county manager. It was something that one of the citizens, I've heard more than once about this. It was a concern about our late fees on the water bills. We've got one fee if you receive it after the 15th, the payment's received after the 15th, and then another fee if it's not paid by the end of the month. And as of late, it seems like the mail service is pretty unreliable and pretty slow. And these folks that contacted me, you know, had concerns over that and some fees that they had received. And, you know, if we would at least look into it, and the manager, if you wouldn't mind, to just at least provide us with the history of our fee structure on how those came about.
Okay. Yeah, I'll get with Jonathan and we'll look at it. We've looked at this before, and have made some changes in the past, I believe, but we'll look at it and get back with you.
Thank you.
The first charge was, do you know what that is?
I think it's $10 if it's not received here by the 15th, and then it's $50
If they cut off,
if not paid by the end of the month.
Yeah, the first fee is $10. If it's not paid by the 15th, we actually give customers to the 18th. And the second fee is by the end of the month if we have to send a employee out to disconnect and then reconnect the meter because of non-payment. So that's to cover the cost of sending the employee out first time, back out the second time to reconnect the meter.
So the $50 fee is a turnoff, a reconnect fee.
Disconnect, reconnect.
So if they don't pay their bill for 1 month, they'll cut the water off.
That is correct.
Okay.
That's the current policy.
Okay.
Do you want, tell us what you exactly asked. Do you want us to look at that, or?
I think we should, given the state of the economy, I think that's pretty strong that we would cut somebody's water off after not paying it for just 1 month, if they missed one bill.
I guess we had a period of time, Mr. Boone, where we didn't cut them off and we just started back, or where do we stand on that?
That is correct. The executive order expired, was it October? It was October. So we had discontinued disconnections during the period of executive order, and then when that expired, we resumed. Now, we'll say we have worked with customers on payment plans, so if they will establish a payment plan, that we will work with them. So we're certainly trying the best we can to work with our customers, but the county's policy has been, in the absence of a payment plan, if you're not current on your bill at the end of the month, you will be disconnected.
Is the customer contacted prior to cut off?
Generally, we use Code Red to send the customers a message about the disconnection, correct, before we come out. And we request that they contact us with any questions they have.
Okay. I just know how many, you know, as a business person, how many pieces of mail of mine have been lost, you know, in the last 6 weeks. And I just fear if somebody's water bill was lost as well and they just didn't think about it and then ended up getting a water cut off and $50 bill for that.
I think we've probably all seen some of the challenges that the Postal Service is currently dealing with. We do have other options available to our customers as far as online payment or to check their bill remotely. We're encouraging customers to to consider that option because of the challenges that we're facing. But
Okay.
at the end of the day, it's the customer's decision to make.
Thank you, Mr. Bush. Thank you, Commissioner Lake. Other comments by Commissioner, and the item you mentioned to me, I'm going to bring up in a few minutes, Mr. Belfield, if that's okay. What we talked about before the meeting?
Yeah, I just want to say that we do, at least I have, been getting calls about scheduling for the COVID-19
Yeah, I got,
vaccine.
I got Mr. Lamb, I think he's going to be back, excuse me, Mr.
okay.
Hill going to be back in just a minute.
Okay.
Okay, all right, thank you. If there's nothing else, I would call for a 10-minute recess, and then we'll come back and go into closed session. And I would-
Chairman,
Yes.
what is that regarding attorney-client? Because he's in court still.
We wouldn't need him here.
We wouldn't?
No, sir.
Okay.
Okay, all right. And he has been consulted about the subject we're going to talk about.
Okay.
And give us permission to talk about it. Okay. With that said, we'll take a 10-minute recess. We'll come back and be in closed session. And for the public, there would be no action taken after the closed session, but we will, of course, come back in open session to adjourn. Thank you. Okay, there was no action taken in closed session as we predicted, and we have completed the agenda. So at this time, I'd entertain a motion to close the commissioner meeting for the 19th of February.
Close adjourn.
Mr. Chairman.
Make a motion, we adjourn.
Adjourn, yeah.
Note for the camera that our attorney was here for the closed session.
Before I entertain that motion, I will again, on open session, let the public know that our attorney did arrive just before the closed session began from his court that he had here in Nash County today. And with that said, there was no action taken, and at this time, I'd entertain a motion to adjourn the meeting for the 21st of February.
Motion to adjourn.
Motion to adjourn by Commissioner Combs. Is there a second to that motion? Second by Commissioner Belfield. Any questions on the motion? All in favor, let it be known by saying aye. Aye. Any opposed by a like sign. Stand adjourned. Thank you.